Hi there, how are you?
Good.
I'd like to discuss the results of your blood test with you.
Okay.
Your blood test showed that your white blood cell count is elevated. How have you been feeling lately?
I've been feeling pretty fatigued and weak. Every time I bump into something, it seems like I bruise. I've been fighting a fever for the past 3 days. Is there something wrong?
Your blood tests show that you have acute lymphocytic leukemia.
What does that mean?
This patient has acute lymphocytic leukemia. There are several varieties of leukemia, some of which include acute, chronic, lymphoid, and myeloid. They are distinguished by the type of cell that is affected and the rate of progression of the cancer. In the case of ALL, what happens is there is a translocation of the DNA between chromosomes 9 and 22. So basically what happens is there's some little information that switches from each chromosome onto the other one, and we now have the creation of chromosome 23, which is known as the Philadelphia chromosome.
So what actually is leukemia?
Acute lymphocytic leukemia arises from the production of immature white blood cells, also known as lymphocytes. The error that's occurred in the DNA of these white blood cells causes them to increase at a rapid rate. So normally in your bone marrow you've got lots of red blood cells all over, but they're just a few little white blood cells scattered within there. So what happens is that once these white blood cells have rapidly reproduced, they crowd out the other cells in the bone marrow, so leaving very little room for red blood cells and platelets that are normally produced at homeostatic levels.
So where in my body is the production of these cells?
Do you mean the red blood cells, white blood cells, and platelets?
I can help you to understand this. It is a complicated process after all. Red blood cells, or more commonly known erythrocytes, are produced in the red bone marrow. Red blood cells are responsible for transporting oxygen, carbon dioxide, and nutrients throughout the body. In early development, red blood cells are called hemocytoblasts and have a nuclei, but as the cell matures, the nuclei disappears. This allows for more absorption of oxygen, and it also allows for more room for hemoglobin. Leukocytes, or more commonly known as white blood cells, help fight the body from infection and disease. The cells either become a lymphoid or a myeloid cell.
So then what's the difference in the production of these cells in my body because I have leukemia?
The white blood cells are not fully developed and therefore cannot protect your body from viruses or bacteria.
So let me get this straight. Normally, my body should be making mostly red blood cells and a couple platelets and white blood cells?
Yeah.
In a normal person, plasma makes up about 55% of your blood volume. The red blood cells make up about 45% of your blood volume, and platelets and white blood cells make up less than 1% of the blood volume found in your body.
So what sort of things should I be worried about?
You are at a high risk for infection. In normally functioning cells, the T and B cells are used to fight infection. The B lymphocytes act as a military intelligence, while the T cells can be thought of as the soldiers of the body. They destroy the invaders that the B cells recognize, but however, the cells in your body are not fighting infection properly.
You may also experience bone or joint pain, as well as an increased risk for urinary tract infections, maybe appetite loss and weight loss.
So is this what's causing my bruising then?
Your bruising is actually most likely due to a decrease in the number of platelets that you have in your body. Your platelets are responsible for the prevention of blood loss, so because you have so few of them, it leaves you more prone to bruising and bleeding.
So my grandma had cancer, and did her having cancer increase my risk for getting leukemia?
The cause of leukemia is still unknown. However, the environment seems to play a major role. So smoking, increased exposure to radiation, and certain chemicals can certainly influence this.
So what's my next step? Is there treatment?
There are treatment options available, some of which include chemotherapy or a bone marrow transplant. So I know this has been a lot for you to take in today, so if you'd like to take a few days to process everything, make an appointment and come in and we'll discuss your treatment.